About 113 health workers in Nigeria has tested positive of coronavirus. About 113 health workers in Nigeria have so far tested positive of COVID-19, and the Minister of Health, Mr. Osaji, announced that at least 40 health workers in Nigeria have tested positive for the virus. 40 health workers over there who had been quarantined in the last 2 weeks due to exposure and did not be able to contribute to effort of the health sector. On Thursday, Mr. Hell, while responding to questioners at the Danish Presidential Task Force for COVID-19, briefly said that the number of infected health workers has increased to 113, and about 6% of the total 1,728 infected persons. He said that the latest figure they have is that there are about 113 people in the health sector infected with COVID-19. The federal government had any banned private hospitals from treating COVID-19 cases, saying that many of the health workers are not trained to handle such disease. The hospital were subsequently, when they are building, were disinfected. The federal government have now asked private hospitals who are willing to treat COVID-19 patients to register with their state health ministry and ensure proper training of the staff. As of April 29, a total of 1,728 persons have been confirmed to COVID-19 in the country. All through 307 persons have been successfully treated and discharged. On April 4th, Aliyu Yakubu, a medical doctor aged 60 years, died at the Nigeria Air Force Reference Hospital, Katsina State, after contracting the disease virus. A week later, his wife and children tested positive for COVID-19 due to their vulnerability to this disease, and health workers have been advised to take extra precaution in handling suspected cases. Mr. Ali noted that personal protective equipment have been made available for the health workers. He also said that health workers who cannot handle the COVID-19 pandemic have the option of leaving. Those who cannot handle it have the option of requesting to be excused and someone else will come in. Following numerous complaints by health workers and their union, the federal government announced its decision to give 5,000 frontline health workers life assurance, which has been fully paid for the Nigerian insurance industry. A special COVID-19 hazard and investment allowance of 50% of consolidated basic salary will also be paid to all health workers in Nigeria, like teaching hospital, federal medical center, and designated COVID-19 center for the first 3 months